time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Hi, good morning. It's great to be back with PetSylvania. This is Dr. Bob. I want to tell Dennis, thanks a lot for some great music selections this morning. You're such a great lead-in for my program. I know it takes about 3 hours to get ready just to listen to a half an hour of Dr. Bob. We're sponsored, of course, by Elanco, the makers of Trifexis, Comfortis, and Reconcile. Trifexis, heartworm and once-a-month flea control pill. Comfortis, a once-a-month flea control pill. And Reconcile, a animal-approved Prozac for behavioral issues. Esplin Medical, the maker of premium environmentally friendly scrubs. They are 80% natural fiber, which makes them breathable. They are just like wearing pajamas. They're so comfortable. They're naturally stain resistant. They're antimicrobial naturally, and so they're really great to be, hauling around the doctor's office or the hospital. So if you have to buy your own scrubs, I want you to give some thought to checking out Esplin Medical scrubs and buying a pair. I think that you'll be sold, and you'll want to buy more and tell all your friends about it. You can learn about Esplin Medical Scrubs, more about bamboo, and place an order at www.esplinmedical.com. And then, of course, my office, Sylvania Vet. We've been voted best vet for the last 6 years, and we're waiting anxiously to hear for this year's running as to whether or not we won again. We'd like to think that we would, but they're going to announce that at the last issue of the Toledo City paper in the month of February. So that'll be an issue that we'll anxiously await coming out to find out if we won. Want to brag a little bit about our doggy daycare. It's really second to none. 2,000 square feet inside of a padded floor, which makes it safer and more comfortable for the dogs, less likely for them to slip, slide, hurt, and damage knees and ankles. We see animals coming from other daycares with those kinds of injuries, as well as injuries that occur because of dog interactions. And things will happen, play will happen, but our animals are well screened, and then there's always at least two people on the floor with the animals so that we control the intensity of the play that's going on. And then outside is 2,200 square feet of fenced-in, secure, pea gravel surface area with play toys for the animals. And in the spring, in summer, there are pools with water for them to play in and swim in and lounge in and just have a really great time. And there's no mud. There was a post on Facebook the other day where the daycare said, well, all our animals are in today because we don't want them to get muddy. Well, that implied to me that their outdoor area has been grass that's been gradually beaten away, and then if it isn't frozen and it's wet, it's going to be muddy. You certainly don't want to go pick your dog up at daycare and have it look like it's been in the mud wars. And so I'm very proud of of the staff and the way they control daycare and the quality of experienced supervision that they gain. You'll find that if you come, that the daycare area is immaculate and it's clean and it's staffed full-time with employees that have no other responsibility other than taking care and supervising the animals that are in their stead. And what you can do is you can call Sylvania Vet and ask for Tabitha, and you can schedule a free interview to come, and your dog can have a short introductory period to see how it's going. So doggy daycare at Sylvania Vet is a tail-wagging experience. Ear infections are the second most common infection that we see in dogs. Dental disease, and cats for that matter too, but dental disease is the number one infection that we see in adult animals, but ear infections are close behind. And so how do you know if your animal has an ear infection? Well, head shaking, scratching at the ears, rub the ear, and there's a little bit of a lean and a head tilt into it, like acting like, oh, that feels so good. That's an indicator. You flip up the ear flap on a floppy-eared dog, and you might get an odor. You might see some redness. There could be some appearance of dark wax, all an indicator that the dog needs to be seen. And then, so when you come in, then we're going to take a look with with an instrument called an otoscope. We're going to try to determine what's going on. And so we look in the ear and we're going to see something goopy or something brown and blackish and dry looking. If it's a young animal, and particularly if it's a young cat that's coming in as a stray, we might very well find ear mites. Sometimes we see puppies that come out of the puppy mills that the dogs have ear mites as well, but they're less common. We can see growths and we can see cysts. And so one of the things that we do to help assist us with our diagnosis and prescribing the proper medications is to do an ear smear, where we're taking some of the debris, smearing it on a slide, and then looking at that slide to determine what the cause might be. Is it bacteria? Is it yeast? Are there ear mites? There can be all three of those things, and then that's going to influence how we do the treatment. And then we're going to want to do a recheck, and that recheck is really, really critical, because it may look good. The dog may be acting normally, but down deep there may still be some debris. Down deep there may still be a mite, but we do another ear smear and put an end point to it. And at that point, then we try to put together a plan to help maintain healthy ears. If we have a dog or a cat where the ear infections continue to come back, or they just never get completely cleared up, it may well be that we're seeing an animal with an underlying allergy, but it may also mean that the dog needs to have, or the cat needs to have, their ears flushed to get them cleaned out and get all the debris all the way down to the eardrum cleaned out of there. Make sure that the eardrum looks healthy so that it's not ruptured, or that there's not evidence of an infection in behind the eardrum, a middle ear infection, if you will. That's how we attack it. We use a video otoscope to look down in the ears, so we can literally watch the ear flush underwater as we're flushing the earwax and the debris out of that ear. And that way we know we're not going too deep and that we're doing a thorough job. And we use an instrument for the flushing that's called, incidentally, an irrigator, and it enables us to flush fluid in and then suck fluid out and flush it back and forth as we get that ear cleaned out and turn it back to as healthy an environment as we possibly can. So if your dog has chronic ear infections and it hasn't had some diagnostics done on it, that's really the next step that should be done. There's a lot of concern amongst pet owners about elevated temperatures, fevers. What's a normal temperature for a dog or a cat? And interestingly enough, it's plus or minus. It's 101 degrees plus or minus a degree. Those are considered normal rectal temperatures in the animals that we take care of. And you may have seen some ear thermometers used, and we did those for a while, and we found that the results just weren't accurate enough, so we kind of gave up on that as well. Now, a fever, when it's caused by infection, is not necessarily a bad thing unless it gets really, really high. And we'll sometimes see a cat, particularly, kind of like babies. Babies can spike a really high temperature, and the pediatrician doesn't get real concerned. And so we don't get real concerned if we see a cat that has a temperature of maybe 105. So an animal with fever because of infection, whether that be an abscess or upper respiratory infection or regardless, that's called febrile temperature, and that is done by giving something like, if it's you or I, we're going to take some aspirin or some Tylenol. If it's the baby, you're going to give some Tylenol. Unfortunately, none of those products are safe, but if we need to bring that temperature down, we're going to use something chemically, injectably to bring it down. Using ice, anything like that's not appropriate and can actually make things worse. On the other hand, hyperthermia, if you've been in a car and you get too hot or you're out in the sun too long and the dog gets overheated and that temperature goes really high, now you want to use something to bring that temperature down and bring them down quickly. And so one of the best ways to do that is to wet the animal down and then put it in front of a fan and let that fan blow across. If your dog's temperature, or they're nearly unconscious, or they're panting so hard their tongue is purple, you need to get that animal in as quickly as you can, but wet it down first and then get it the heck into the office. So a temperature is not necessarily a bad thing if it's febrile and it's associated with disease, because it actually activates the white blood cells and they work and they go to the site of the infection more aggressively. So a fever can be a friend, but it can just make the animal feel kind of gunky. We don't want that fever to go on for days and days, but a temperature of 103, 104 is not something to panic about from our perspective. So we're going to take a break and we'll be back in just a couple minutes. Well, I'm back, and I wanted to talk with you about how the doctors at Sylvania Vet feel, and there's 7 of us, about how to make anesthesia as safe as possible. One of the first steps in that process is a thorough pre-anesthetic evaluation. So every animal that comes in that's going to be anesthetized gets a current on-the-spot physical exam, hearts are listened to. And then we strongly recommend that pre-anesthetic blood work be done. And we have 3 different levels. The older the dog gets, the more extensive that pre-anesthetic level is. But it always includes for us an electrocardiogram. And at the 2nd and the 3rd level, which is any animal from a year on, they also get a urine as well as blood chemistry tests. At pre-anesthetic level 3, they're getting a 25 parameter blood chemistry test, an electrocardiogram, and a urinalysis. Extremely thorough, but it enables us to have the kind of information that we need to be able to make anesthesia as safe as possible. It's not an area where we think that you should really cut corners. One of the cool things that we do is that we work with a lot of breeders. Sylvania Vet's very breeder friendly, and a breeder knows to choose a veterinarian that's willing to work with them and accept the knowledge that they bring about the specialty of their breed. There are certain characteristics of individual breeds of dogs that not every veterinarian can know, and it's not possible to know all that. But a person that's an expert in that breed, that raises their breed, they know that. That's really very helpful to a breeder. And so if we like to acknowledge their knowledge and then work together as a team to enhance the health of the animal. What else causes us to want to choose us? Well, our 24/7 availability, of course. We have the ability to do in-house progesterone tests, which are accurate to the 100th of a decimal point, and that's important in choosing a proper breeding time, and it's important to choose proper times if we have to do a C-section. We did a C-section this week on a Mastiff, and the progesterone test said it was time to go, and we were able to use this progesterone in order to be able to save the litter, because she went into premature labor at about day 42 of the heat cycle, which is 9 weeks, and as a result, she would have aborted at that point. But by monitoring the progesterones, we were able to give her progesterone supplements and maintain pregnancy to term. We got 3 live puppies out of that delivery, and that was a real success to be able to manage that premature labor and prevent the abortion of the litter. And so there's a lot of things that that when you buy a purebred dog, you really don't know what's going on and getting those puppies to sale. And it's part of the reason why buying a good quality purebred dog can be a bit expensive. But you know what you're getting. You know that the traits of the specific breed that you're getting. I would never encourage you to buy a purebred over a mixed breed if all you're looking for is a pet in the house, because there's a lot of great mixed breed dogs out there and a lot of great dogs that are looking for homes through the rescue organizations. I'm a veterinarian, and so obviously I know that there's a tremendous amount of advantages to having pets, and I think it's useful to pass that information on. And most of you that have pets, you probably wouldn't be listening to my show if you weren't a pet lover. Most of you may not know some of the specifics, some things that actually occur physiologically and psychologically to people that have pets in their lives throughout their life. There was a study done in Japan, went after 50,000 people, and what they found out is when they did this very large study, that if people had pets in their lives their whole life, they lived 3 years longer, all things else being equal, than people that didn't have pets in their lives. And you would hope that those were quality years, and I think that that's fair to assume that that was probably true as well. Did you know that if you're petting your dog or your cat for as little as 20 seconds, it reduces your blood pressure, and it also reduces the blood pressure of the pet? Those of you that are on blood pressure medication, I'm not suggesting that you just start petting your pet and don't take your medication, but it is something that you can find that might be very relaxing. And at a time of stress, the animals kind of pick up when you're stressed and they'll come to you, and it's almost like they know, come here and pet and cuddle with me a little bit because I know it's going to help you calm down. Kids that live in households with pets have been documented to have higher IQs, are more responsible, are better friends of fellow students in school, less likely to get into trouble and less likely to cause difficulty. And teachers can recognize that at times, and I think that's pretty interesting. We do know that there's been some great studies with autistic children and how pets help them relate to humans, where otherwise they might be off in the world of their autism and not be able to be an interactive member of a family or of society. And then, interestingly enough, there have been dogs that have been trained and they're able to detect a disease. There was a doctor down in Florida that trained a dog to detect melanomas, and that melanoma is a tumor of the skin that we all know of, and this dog is able to find melanomas smaller than he's able to find with his magnifying loupe. There are dogs that have been trained to sniff urine and can detect bladder cancer. They can sniff breath and detect lung cancer, and these are all documented studies. Then some dogs are trained and they can pick up on the fact that an epileptic is about to have a seizure, or that if their blood sugar is dropping too low and they might be in danger of having a hypoglycemic event. It's a fascinating study. And the last story that I have is a study that they did how it helps people from a social perspective. And that is they took a guy and dressed him up as a grunge ball and put him on a bench in a mall and videotaped him while he was sitting there. And you could watch people not look at him as they walked by, but literally widen the radius of that so to stay away from him. And then they took him in the same scenario with the dog, and people actually came up and engaged him in conversation when he was holding the dog on a leash. So I think it's pretty amazing. And one of the great ways to learn more about what we just talked about is a book that I like a lot, written by a veterinarian whose name is Dr. Marty Becker, and the name of the book is The Healing Power of Pets. I think you'll find it very interesting. Annual visits for dogs are kind of a given, but they seem less of a given for cat owners. And we hear all kinds of stories about, well, my cat never goes out, so he doesn't need shots, so I don't need to bring him in. I want to comment that the most important reason for an annual visit is not vaccines. Those are important health issues, but the exam and the consultation is far more important. The cat-friendly practice designation that we have and the methodologies that we have for helping you transport your animal and our handling of your animal should make these visits less stressful. So the argument that my cat just gets so stressed out that I don't want to bring him in is something that we want to work with you on, because we definitely want to see your cat on at least a once a year basis. And then finally, we are having an event for cat-friendly practice medical health issues on Thursday, February 21st at Sylvania. Call 419-885-4421 to learn more and to make a reservation. We're going to have door prizes for everybody and a raffle at the end of the evening. So we're going to take another break and we'll be back. You know, one of the things that we do to try to make a visit less stressful, whether it be for a dog or a cat, is that we try to make it so that when we do have to give injections and we give vaccine injections to the animal, that it is less likely to hurt. When you take a needle and you put it into the vials to pull up the vaccines, that needle gets dulled by the rubber damper on the end of the two vials that we have to use. And so what we do is we change the needle and put a brand new needle on there so that it's nice and sharp. When it's sharp, it slides in smoothly and the animal barely knows that you're doing it. We tend to distract them and try to bribe them a little bit into ignoring what we're doing. That really is helpful as well. Another important wellness thing that I want to recommend is stool checks done on your dog at least once a year and preferably twice. So twice a year stool checks on your dog and once a year stool checks on your cats are really very important. So we've got some things coming up. I just mentioned the cat-friendly seminar seminar, and that's going to happen again on Thursday, February 21st at 7:30 at Sylvania Vet. So give us a call, 419-885-4421. You're going to have a really good time. Saturday, February 9th, puppy kindergarten and basic obedience classes start. We have also a basic obedience class starting on February 19th, which is a Tuesday night. There just isn't a dog out there that if they've never been to obedience class, regardless of their age, that won't benefit. But we think that starting puppies at a young age, 8, 9, 10 weeks, is a really great time. It helps them from socialization standpoint. They start to learn some manners. This is all really beneficial. Westminster Dog Show, the premier dog show of the dog world, is February 11th and 12th. Sylvania Vet's going to be a sponsor of that. Tune in, watch for our ad, and let us know what you think, because we'd love to hear what you think about our ad. I'd like to thank Elanco, makers of Trifexis and Confortis, Esplin Medical, makers of bamboo cotton, environmentally friendly, as comfortable as PJ scrubs, and Sylvania Vet for sponsoring today's show. I want to leave you with just a couple thoughts. And at Sylvania Vet, pet care, is our mission, but customer service is our obsession. And I think you'll see a difference if you come and spend some time at Sylvania Vet. You are going to see that we are different and we are unique and we are special when it comes to the way we provide care.